I talk about the uncertainty principle. Most of us are quite comfortable in living with that, but someone suffering from anxiety is looking for a degree of certainty that, we can't give them.
Dr. O'Sullivan, you've been a psychiatrist for many, many years and have even taught psychiatry in medical school. But when it comes to anxiety, we know that anxiety is a normal human experience. What makes it become an anxiety disorder?
Well, for me, in my practice, anxiety became not normal or abnormal because of its severity. When it was present to the degree that it interfered with a person's ability to function in their lives, family life, at work, their social life, then there's something wrong. We're looking at a condition that needs treatment. Or when anxiety becomes persistent, it just doesn't go away. The person experiences anxiety day after day, week after week, month after month. Once again, we're looking at anxiety disorder as a mental disorder.
Okay. Thank you. So severity and persistence being
Persistence and severity. They're, for me, the two major features that I identify.
And so can you describe what the symptoms are of anxiety and anxiety disorder?
Well, the symptoms, of course, the dominant symptom is anxiety. Anxiety accompanied by edginess, irritability, being uneasy, insomnia, having difficulty concentrating, not being able to enjoy life, fatigue, and often physical symptoms, headaches, muscle aches and pains, and that type of thing. Quite distressing. It's quite distressing.
What are some of the major types of anxiety disorder?
Well, if I can start by saying that anxiety in general, anxiety disorders in general, surveys show that between 18 and 30% of the population will experience some type of anxiety disorder during their lifetime. Regarding specific anxieties, we talk of the 12-month prevalence. In a 12-month period, about 7 to 9% of the population will experience social anxiety disorder. 7% of the population in a 12-month period, panic disorder. And if I can look at my figures here, phobic disorder, 7 to 9%. And these are the more common and better known types of anxiety.
There are also a number of other anxiety disorders that are less common. Can you touch on what those are?
Yeah. We have generalized anxiety, and the figure there is 3%, agoraphobia, 2%, separation anxiety, 1 to 2%, and OCD or obsessive compulsive disorder, 1 to 2%.
Okay. So there's so many different types of anxiety that you've identified. What would you say, what do they all have in common? What's the common thread amongst all of this?
I think the underlying issue that I have found for people who experience anxiety is their inability to cope with uncertainty. I talk about the uncertainty principle. Most of us are quite comfortable in living with that, but someone suffering from anxiety is looking for a degree of certainty that, we can't give them. For example, a person with a fear of flying. And most of us are comfortable with the fact that it's highly unlikely the plane will crash. But the person with anxiety is looking for a 100% guarantee that that won't happen. Also, people with anxiety experienced a heightened level of anxiety in situations that will result in anxiety. So when I feel anxious in a certain situation, that is normal for me to feel anxious. The person who is prone to anxiety will have the same experience, but in a much more exaggerated way.
So discomfort with uncertainty, just not being able to put away those worries as a normally anxious level of anxiety would indicate.
Yeah.
Yeah. Is it fair to say that anxiety disorders present in different ways in people? For example, most of us think of an anxious person or someone with potentially with an anxiety disorder as being, you know, a bit jumpy and nervous and that sort of thing. But others who have anxiety disorders present as very calm, the opposite. So what do we make of that?
Yes. I think we all come across people who outwardly look calm and in charge of things, yet in a sense we pick up that underneath things may be different. So mostly people who suffer from anxiety are visibly anxious. And then you have those who have a need for control and perhaps have had a need for control lifelong. And they can control the anxiety and they have that outward appearance of calmness and control. But within, they're experiencing tension and unease that is invisible to the rest of us. Often these people are high achievers. They need to be in control of their lives. Everything has to be in order. Often again, they have difficulty coping with the unexpected. They're not prepared for that. In spite of the fact that they have this control, the inner tension can lead to specific problems like headaches, high blood pressure, or they may start self-medicating with alcohol and end up not only with anxiety, but with an alcohol problem. And in this way, they experience major difficulties in their private lives.
Thank you, Dr. O'Sullivan. Next, we're going to talk about the causes of anxiety disorders.
Thank you.